depending on where you're at. My name is Josh Mosier. I am the Vice President of Operations for KONZA Health. Today's webinar, we are going to be joined by Lesley Berkeyheiser, who is with DirectTrust. We're going to talk about cybersecurity practices for small to mid-sized healthcare organizations. A couple of announcements here is, if you do have any questions, just submit them in the Q&A, not on the chat, but on the Q&A section on the top right corner on your window, and we'll make sure we get those answered. We'll probably do those sporadically throughout our time and not just hold them to the end, depending on the relevancy of the question at the point of the presentation. Also, we will record this and make this available after the fact, so if you want to rewatch this or share this with anyone else on your team, that would be outstanding. So I'm going to go ahead and just turn things over to Lesley to introduce herself and talk a little bit about today's topic.
Awesome. Thank you, Josh. We can go to the next slide, please. As mentioned, I'm Lesley Berkeyheiser. I'm wearing a couple of different hats today as I present to you. First, I am a senior assessor with DirectTrust. And in that, I get to basically audit organizations in the healthcare data exchange space and their compliance with privacy, security, and cybersecurity. In addition, I'm wearing another hat, and that is my national co-chair for privacy and security, work group, for the work group for electronic data interchange, or we call it WEDI. So I'm wearing multiple hats. Bottom line is, I've been involved in healthcare data exchange for a number of decades now, and I've always found myself in between the technical teams and the business ops and clinical areas. And because of that, I'm here today to hope to share with you some practical thoughts and comments and raise your level of awareness about cybersecurity readiness, and also to leave you with some really good tips that you can take and disseminate across your organization. So, no matter what type of entity you represent today, and whether you're on the technical side or the business operations or clinical side, I'm hoping you get to have something to take away. And that communication between those two sides of the house, if you will, has never been more important than in today's age of constant cybersecurity attacks. Since I mentioned no matter what type of entity you represent, I would like to begin. We're going to have 4 polls throughout the presentation, and I'd like to ask Josh just to start by putting up the very first poll. And the reason is I would like to know who our audience is today, whether you're representing organizations that are subject to HIPAA as a business associate, as a provider, as an employer group health plan, or maybe not subject at all to HIPAA. And it looks like we've got some people responding, so I'll just give that poll a moment, and then Josh can close that out, and that just helps me make sure that my comments are as appropriate to all of you as possible. So thank you so much. I see we've got about 40% who voted. We'll wait a little bit longer. We've got 50%. I know we're just starting today, and we're expecting that most people will probably listen to this even after the fact. So it's my hope, whether you're here today in person or listening afterwards, that you get some value out of this presentation. Josh, if you want to go ahead, I know we've got about 63%. If it gets a little bit more, have a few more people vote. We can come back to that. I can get started, then you can interject with what the tally was when you're ready. So going ahead to my first slide, you can go ahead to the next one. Did you know that just in the first half of 2025, 29 million individuals were negatively impacted by healthcare data breaches? That's this year. I'm not talking about the ones we all know about from last year. Healthcare data breaches are continuing to be a challenge for organizations that are subject to HIPAA and all business associates. And this has been exemplified by all of this happening in the first 2025. The Office for Civil Rights, who is our governing body from a business governmental perspective that monitors and reports on these healthcare data breaches, said that 4 out of the 10 breaches that made up these nearly 30 million records that were impacted, 4 of them were related to providers and 6 of them to business associates. So data breaches are typically what happens when cybersecurity attacks are successful. Certainly you can have a cybersecurity attack that's not necessarily data breach, but most of the time it absolutely is. So again, some practical tips for you. Just keep in mind as well, as we go, I'll be talking about other organizations and groups within our federal government that are very helpful in this space, and they have free or very cost-effective tools and other kinds of reference materials. One that I'm going to be quoting about is ASPR, the Administration for Strategic Preparedness and Response. Charlie Hess is my contact there, and I often hear her speak. And not long ago, she said, you know, every breach costs about $9.7 million. You can go to the next slide, please, Josh. I'm just going to do a brief introduction about DirectTrust. We're going to go quickly through that, and then we're going to spend the majority of our time in those top 10 cybersecurity tips. I'll pause a little after that about the importance of demonstrating trust. It doesn't matter to me who in the healthcare data exchange ecosystem you represent. We need to be able to trust each other, and being able to prove your trust is really important. And we'll have some time to handle questions. Josh will be monitoring the chat as well, and I'll interject if I can. You can go to the next slide, please. DirectTrust basically has 4 main areas in which we concentrate. We are not for profit. We are actually a combination. DirectTrust provides secure messaging services. You may know us from that. Sending secure email, for example, between providers before the electronic health records, or if they don't have that capability, that's one of the main things that we do. We have a membership body, a standards body. We do accreditation, and that's really where I'm speaking from today, the whole accreditation side of the house, where we do accreditation and trust services. We offer privacy, security, cybersecurity, and various programs for up to like 40 different types of healthcare industry businesses that we can come in and offer an independent third-party review. We review and accredit KONZA Health for accreditation, and we also offer high trust assessment services. You can go to the next slide, please. We've got some recent quarterly metrics, and we've actually now are above 3 million of DirectTrust trusted addresses. That means the secure messaging that goes back and forth. That's how many point A's and point B's that we have. We're really pleased to say we are over 6 billion cumulative messages since we began live in 2014. We're very proud of that. You can go to the next slide, please. So right into the top 10 security tips, and go ahead to the next slide. We'll get started. So what you're going to have is a leave behind. You have a couple of things. You've got these slides to refer to. But as I go through the slides, I'm going to kind of pepper them with stories and practical suggestions. In addition, we're leaving you with this key resource, and you just see this. You're not supposed to be able to read it right now. I want you just to see that you're going to get it. And you can see the top 3 points for small to mid-sized health organizations are listed here. It also has on the back side up to 10. And it also has a place, KONZA Health's name is on there, Wheaties' name is on there, and DirectTrust's name is on there. Now, here's your first homework item. I'd love it if you could take this leave behind document, and you can go ahead and remove DirectTrust. You must keep Wheaties' name on there, but you can remove the DirectTrust name and put your organization's name on there and disseminate it across your organization, kind of as a cheat sheet or leave behind for all your workforce members, because cybersecurity readiness equals patient safety, and it's everybody's business. Now, this was created as part of my work group for electronic data interchange, the privacy and security work group. We got a group of people together and we said, what is cybersecurity? You know, we're all familiar with what is HIPAA privacy and what is HIPAA security, but cybersecurity is a relatively new term. And let me tell you, there's an entire industry supporting cybersecurity now, from people who do forensics and people who do ransomware negotiators and insurance and all those kind of nitty-gritty, gory technical things. But cybersecurity itself, I like the way Charlie Hess from the Administration for Strategic Preparedness and Response said. She said, you know, when I think about it, it's just a whole lot of little things. So I'm hoping that what you're seeing are what we call the top 10 little things. Not necessarily in any order, although we tried to put them in order, and not necessarily you're done when you get the 10. Instead, every one of them has a whole other graduate level that you can go to. So going to the next page, we're actually going to go ahead and get started. Just before we do, this is the beginning of this leave behind document. It has this note at the top and says, why is it so important? Why is cybersecurity so important? And remember, cybersecurity and all the things that you can do to not only prevent an attack, but be ready when you have an attack, because unfortunately, it's no longer a question of if you're going to be attacked. It's probably a matter of when. You've got to be ready for business continuity purposes, because remember, maintaining that data, the protected health information, the confidentiality of it, whether it's administrative, it has, patient names and enrollment information, or billing and scheduling information, whether it's clinical, whether it's financial, all those pieces of data, those data elements, and keeping them protected is how you preserve patient safety. So again, we're going to talk a lot of times about the bad actors and what they're doing, but remember that the small and mid-sized entities, unfortunately, are particularly vulnerable. I don't know how many of you got caught up in the whole F5 vulnerability, the exploitation of the F5 firewall devices just a week or two ago, but that's a great example. So unfortunately, you're all the target. Go ahead to the next slide, please. I mentioned that as we go, I'm going to talk about other, particularly governmental, but not necessarily, like WEDI is a membership organization. But what I have on the screen is the Health and Human Services 405D effort. If you are at all interested in the technical components of this, and you want to stay up to date with who's been attacked with what, and you want to get those bulletins, going out to the HHS 405D, and I have the exact website in the end, it's a really great place to sign up. It gives you very practical and helpful tips and a safe space to discuss when another entity like yours may have been attacked and what did they do. So again, their motto, of course, the cyber safety is patient safety, something I'm driving home today. Go ahead to the next slide, please. I think now we're really into our top 10. So here's number 1. And Josh, this is where I also have a polling question if you want to start to get that one ready about your assigned champion. But the way we say it is, do you have a cybersecurity champion, or who is in charge? Great, he placed the poll up for us. You can go ahead and begin to respond to this as I start talking through this topic. You should have an assigned person, just like you have a privacy and security officer, and everybody should know who this key person is. And ideally, they have a senior level role across the organization. It doesn't matter if you have 5 workforce members or 500 or 5,000, you should have someone that you know who to go to when things go wrong. You all know the time to know who to call when you can't get into your system. It's too late if you didn't figure that out before you lost your system's access. So making sure that you have this person appointed is huge. I have a couple of stories below. You can see this one was from our Christiana Care CISO in 2024. And she said, it's happening. Our CFOs are getting Teams calls from their CEO. And that was kind of like, yeah, we know, we would be able to figure that out. Well, not long ago, as one of my WEDI activities, we had hosted the author of the Level Blue report on cybersecurity readiness. Level Blue does a lot of statistical kinds of analysis across the world with organizations, and specifically in the healthcare space, to say, hey, if you really think you're ready for a cyber attack, what are the things that you're doing, and would you really say you are ready? And so she was part of conducting this work, and she was the author of the report, and we hosted her at our WEDI event. She told this story. She said a CFO got a video chat from their CEO on the weekend. They told jokes. They mentioned kids' names. There was no reason for that CFO to think anything was wrong. The CEO asked the CFO to transfer, a large amount of money offshore to the Cayman Islands, do it a certain way and a certain day, etc. The CFO thought it was odd, but that was his boss. He knows him. They were talking. Clearly, they must want it for some reason, so he went ahead and did it. Well, guess what? That was a cyber attack. And the next day, the FBI went to the CFO and said, did you really transfer that money? And he said, yeah, that was my boss. He told me to do it. So this is really getting difficult. And in fact, I have some statistics for you. I think it's 62% of the workforce that were queried by a recent study through Level Blue said that they can no longer tell the difference between a real conversation and a not real or a fake or a deep fake one. So just be really careful. You need that point person in place. That person is responsible to make sure the senior level understands how important cybersecurity is, and then also that everybody else understands it's their responsibility too. The top point here, number 2, is your workforce members. And notice it says employees. I like to substitute that with the word workforce members. That's a HIPAA term, and that means anybody under your direct control. So that would be full-time employees, part-time employees, volunteers. It would be contractors. It might be anyone that you give direction to. It's actually a legal term, but keep in mind it's a broad thing here. It's anybody who's coming across your systems and your data. Make sure that your workforce members understand, and that should be in writing routinely. They should have ongoing training, all different kinds of training, from phishing campaigns to policies and procedures to general awareness. But they need to understand how you, the organization, want them to handle the data and the technology. So again, how do you use the internet? How do you use email? Do you have any closure there, Josh, on our poll? Did we get any feedback with how many organizations actually have someone appointed?
It was 100%.
Awesome. I can't tell you how happy I am to hear that. Okay, let's go to the next one. We should be turning over to point number 3, and I'll actually spend a decent amount of time here because this one is huge. And you know, all of you on the call today so far are subject to HIPAA. So you know, we've been hearing about doing a risk analysis and doing ongoing risk management since HIPAA security was put in place in 2005 and 2006 timeframe. So the HIPAA security rule said, hey, covered entity and business associate, you should know where all of your electronic protected health information is. You should know how you create it, or perhaps you just receive it on behalf of someone else. You should know how you maintain it and how you transmit it. And I like to spread that a little further, because one of the things that kind of drives me crazy about the way we got these rules decades ago is that that's very much about electronic data. But if I'm representing or helping one of your organizations, I want to know about all of your data. I want to know if it's spoken. You know, if we've got people on the phones and they're doing case management, or they're doing billing, or they're doing the just handling initial incoming phone calls, what kinds of data are they speaking? I want to know if they're writing things down or working, printing things out, or using fax. So think about all the modes. I like to expand this, but I want to say that you want to know, I call it the tripod, about your organization to really do a good job in doing your HIPAA risk analysis. And what I'm doing is trending that forward for cybersecurity. And that means you have the tripod of the 3 pieces of information you need. Number 1, you know your data. I just mentioned it's all the data from my perspective, because you got to protect all of it. You need to know, as mentioned before, how it's moving through your organization. And you need to have a good understanding of your uses and disclosures. Those are words that come from HIPAA privacy. But you see how this kind of all works together to support you getting a comprehensive review. So that's know your data. Every organization is different. You might be a provider and compare yourself to another provider, but one might be an infertility provider and one is an optical provider. Very different kinds of data that are handled, different ways it moves around. The second leg to the tripod here is your technology. You have got to know your technology. So if you're technical or you work with a technical team, I would transition this word into having a good, strong, real-time asset inventory. That means we always know who all of your endpoints are. That means all of your laptops, all of your mobile phones, USB devices, routers, firewalls, you name it. Where is the data residing? In servers? Is it in the cloud? All those things are components of your asset inventory. And the problem with it is it moves all the time. You know, just think about this. If you even have a few employees, one laptop breaks down, you have to get another one for them. One person on boards, one person off boards. You've got constant transition. So having that second leg to the tripod of knowing your technology is a huge piece to this puzzle. And you know what the third leg is? I often talk about HIPAA security having 2 strong components or partners, the people and the technology. The third leg to the tripod here is the people. And it's not just the people, but it's the people and what their role is and what the access is to data that they have. And it needs to be the minimum amount appropriate for whatever it is they do for you. Now, I've got a couple of quotes for you. You can see here our OCR director, Paula Stannard. She said back in July of this year, identifying potential risks and vulnerabilities to protected health information is a key step in preventing or mitigating breaches of PHI. OCR often quotes, if you notice, that you go out to the Office for Civil Rights and the corrective action plans when someone has been subject to a breach or they've had civil monetary penalties. There's a little tagline that says, failed to complete an accurate and thorough risk analysis. Almost every single time we see that. And in fact, OCR says, often they see deficient risk analysis practices. Common deficiencies include lacking it entirely or failing to update it on an ongoing basis. So obviously, remember all those pieces I just went through. It's the data, it's the people, it's the technology, it's knowing the threats and vulnerabilities and the likelihood of occurrence. Now, I mentioned the 405, so for those of you who may be technical or want more meat to the technical side of this here, the 405D offerings also go in more detail to mobile device management and mobile threat defense and application security and other areas that I won't go in detail with today. So bottom line is, keep your machines clean. That means patches, keep everything up to date. You should almost, it's so unusual for me now to see something where an end user can bypass an automated system control. For example, if you have anti-malware, years ago I could say, oh, I don't have time to run this today, I'm going to bypass it. It doesn't happen like that anymore. Hopefully that's still the case in your environment too. Keep your machines up to date. Use current software and operating systems. Constantly be monitoring threats and stay so that you are constantly protecting against them. I mentioned the endpoints. They should be secure. All laptops should be fully encrypted. You shouldn't be using any kind of mobile device unless you've got encryption at rest and encryption in transit. We'll come back and talk about that too. And then D, such a simple thing, make backup copies. Not only do you have to have backup copies and you have to have the data and your systems in the way they're configured, but you need to make sure that you can recover from those backup copies. I've already mentioned limiting access, and that would be to data itself, but also to the technology. You want to have a limited number of people who are actually able to keep the software installed and up to date. And again, physical access. Don't forget, we still have front and back doors in the heat of the summer that get propped open. Can't happen anymore. We got to think about the physical access and safeguards. And I've already kind of mentioned the phones. You should have a mobile device action plan as well to the degree you use mobile phones. Go to the next slide, please. Point 4 won't take me so long. Actually, before we get there, are bad actors. I used to think that the bad actors were kids in a garage somewhere, trying to cause problems with a keystroke. Unfortunately, they are professionals. These are people who not only know how to use all of the tools that are in healthcare, they know healthcare. And you all know you're in healthcare. You know how unique and different, and we all speak in acronyms. Our professional bad actors know healthcare these days. And then the toughest part that I haven't mentioned yet, they're using AI, artificial intelligence. I mean, probably the video call example I first gave you was using AI. And so you should be considering using AI too, to the degree you can, because we have to keep up as we are constantly being targeted. And of course, what I'm doing here is calling out one of our CISA. That's the FBI and CISA, our agency for cybersecurity in the federal government. They usually give us these really good bulletins. This particular one was earlier on in the year about Iranian cyber attacks that were targeting smaller and older networks and healthcare systems. But again, they're exploiting unpatched or outdated software, internet connected accounts, and devices. And that's an example of what happened with the F5 devices earlier. There's just an exploitation by bad actors. And look, they exploited one piece of software, and look at all the people they impacted. Go to the next slide, please. Okay, number 4. If you are technical, I'm sure you know what a firewall is. If you're not technical, a firewall is a grouping of code or an application or software. You can think of it as a technical gate. And basically, it is there to keep everybody else out of your network. And so I am seeing organizations set those firewalls to deny everybody, and you allow only by exception. And that means I know who's coming through my doors by whitelisting them. So I'm using a lot of technical terms and trying to explain how they're actually used. But the bottom line here is we are seeing some best practices emerge. And one is that the firewalls are being set to deny everybody. In other words, we're taking our systems, we're putting a protective coat around them, we're keeping the door shut, and we're only allowing trusted partners and customers in by doing a good job of vetting them first. I mentioned the importance of trust in this space, and we're making sure that we're getting all the details about how they're going to get in, the method and way they're going to access, and that basically gets built into your whitelist in your firewalls. I'm definitely seeing that happen a whole lot more since our cyber attacks we saw in a year or so ago. Remote workers, don't forget, after COVID, we all kind of ended up with some ongoing remote workers, and some organizations completely got rid of their sites and facilities. So there are other rules about remote workers. People should be reminded of how you want them to behave if they're working in the kitchen or in the hotel room, etc. Number 5, I've already mentioned, secure your network. I mentioned before, you absolutely want to make sure that you use encryption, and your encryption should cover your data always when it's at rest. And your encryption should cover your data always when it's in transit, when it's moving back and forth between parties or places. And then basically when it's being used or viewed or accessed is when you have all your other controls around it. It's role-based, you teach your people, you control what they can do technically. Last point here is for those of you who are technical, I am absolutely also seeing greater segmentation of systems that are being built. You know, it used to be we had a lot of old platforms that kind of covered whole enterprises. Instead, I'm seeing a lot of smaller components of systems, and that's aiding the organization better to when you have a cyber attack, it's an easier way for you to kind of identify where it is, shut down the part that is impacted, and then basically work to start eradicating and recovering just that part. You can go ahead and go to the next slide, please, Josh. Oh, I wanted to just give a couple of quick quotes from a recent Black Book research report. It's confirming the majority of our smaller and rural hospitals are absolutely lacking funding, staffing, and infrastructure to defend themselves. Go ahead to the next slide. It has a couple of quotes I wanted to cover with you. I'm sorry, I'm just going to go ahead and read them off. 73% of our hospitals said that there was inadequate cybersecurity infrastructure. And out of all the hospitals, there were 127 that were interviewed, only 70%, 70% did not employ a full-time chief information security officer or cybersecurity leader. So all of you on the call today are really doing well. We're having a full-time person who's doing what they're supposed to. The other key point was only 50% had actually conducted a cybersecurity risk assessment. Let's go ahead to point 6. I don't know if you're using payment card data, but to the degree you are, you may want to coordinate with the banks or other processes to make sure that you're using the most up-to-date tools, anti-fraud services, etc. And it's a good idea that you don't use the same computer that you're going to use to have those card payments on it, to also browse the internet. So just some key points there. Multi-factor authentication, point number 7. I hear this all the time, especially in the provider organizations. The doctors don't want me to put this on. It takes too much time. I'll tell you, it is probably one of the single biggest things I see organizations implement that make a big difference in their ability to be cyber ready, is to implement multi-factor authentication. What is authentication? Let's just start with the term. It's having multiple ways of saying you are who you say you are, or your system is who it is supposed to be. For example, if I'm authenticating myself, I may know something, my username and password. I may have something. Maybe I do a one-time a one-time number on my mobile phone, or I have a hardware token or something. It's having multiple ways for me to prove I am who I say I am, so that then we can go ahead and get access. So we're recommending at WEDI that all access to network and applications where there's sensitive or confidential information have multi-factor authentication on them. The GP Cantor report in 2024, they had done a study on the Change Healthcare cyber attack, and they noted that it was attributed to a lack of multi-factor authentication on a legacy server. So we've all learned the really hard way how hard it is if we don't have MFA instituted. Josh, this should be my third poll regarding does your organization require you to use MFA? And if they don't, you should be taking this back and suggesting they reconsider that. As much as it may be a problem for you, if it's your data you're protecting, you'll want, oh, we just have straight A students on our audience, in our audience this morning. 100% that have responded have said, yes, glad to hear it. Go ahead to the next slide, Josh, which should be point number 8. Monitor and manage cloud services. You know, we are seeing such a change in the industry of use of cloud services. You know that I'm an assessor or an auditor, and I've actually been doing this job for, it was ENAC and now DirectTrust since 2010. And I've been able to go across the country and even outside of the country and walk through organizations. And I can't tell you how many times I used to see a network or data closet organizations had on site their systems, and now they're using the cloud service providers. And there are many wonderful benefits. You know, from a business perspective, you can scale up, you can scale down. Great points about having a cloud services support and using them software as a service, for example, or there are other modes you may choose to use. What I wanted to point out was it's a different way to work. So especially if you're moving from having had your own systems on site and now everything is in the cloud, make sure that you do a really thorough review. You conduct that risk analysis about how you're going to keep all of your technical and business controls in place. The cloud service providers, especially the big ones, AWS and Azure and Google, you're able to get what's called a shared responsibility matrix. And they go through in detail and say, you know, we're responsible for this part, but you're responsible for this part. And it's probably the single biggest area of gap that I see is organizations don't realize they still had things to do, or they had new chores to do to prevent the data and make sure it was as protected as possible once they moved to the cloud. The other thing is, I tell everybody, make sure you have multiple instances in the cloud or multiple ways to move that data around. For example, you might have your data in the cloud, but you still drop it to an encrypted tape and keep it somewhere else. Be thinking about that. As much as we all know how wonderful our big cloud service providers are, not a week or so ago, one of them had some sort of blip, and I know I kept out of a few different workflow tools that I didn't even have any idea used them. So we've got to keep our eye on this one. Point number 9, and I'm sorry, I may have said top 10.8 was one I just covered for cloud services. Top 10.9, get technical help if you need it. You know, if you're really small, get an outside consultant or IT support company to help you from that perspective. Have at your fingertips who you're going to call if you get attacked. That would be everything from considering insurance and who may be there to help you from that perspective. Forensics can be all different based on what systems you're talking about. Because, you know, think about this, if you get attacked, the first things your technical people are going to have to do is try to understand what happened. And that may take a number of other people to assist. You're also talking about potentially ransomware. I was telling you before, one other thing I wanted to quote a little bit off topic, but when I was talking about AI, 8% of the ransomware now are because of the use of AI. So we're clearly seeing when organizations are threatened, when their data is blackmailed and they are told, pay this, or we're going to throw your data on the black web and send it all over the place. When that happens, you need to make sure that you have experts available. You might want a ransomware negotiator. These are all types of entities and subject matter experts that should be readily available to you should something bad happen. Again, whenever you're going to move forward with anybody, a third party, do your due diligence on everyone. To the degree they're going to see protected health information, get a business associate agreement. Don't be afraid to ask for service level agreements on your key partners. Don't be afraid to ask them if they have high trust certification or if they are accredited by an entity like DirectTrust. You want to know you can trust them. And although an outside entity is responsible for your day-to-day operations, perhaps, you are still responsible from a HIPAA compliance perspective. Going to the next slide. We're actually coming in on point 10. And this one is big. And this wraps everything else together. And you can see why I began and really early on focused on doing that risk analysis and risk assessment. If you don't know your data and your people and what they're supposed to do and your technology and how it's supposed to behave, then you're going to have a really hard time being able to react and have an ability to restore if you have a cyber attack. So remember, the whole idea of this is you have your backup copies and you have your systems, and that's for your technical people. And remember, if you get attacked, you're not going to be able to use your systems for who knows how long. So I know I'm speaking to a number of business operations and clinical people too today. Think about your own job. And this is where cybersecurity readiness is everyone's responsibility. Let's just pretend that your systems that you always use on a daily basis are not available, period. At an unannounced, unknown date and time, no longer do you have access. Well, you want to be able to continue to protect that data. You want to be able to continue business as usual as fast as possible. You want to be able to make sure that your patients and their data stay safe. Excuse me. So remember, all the things that I talked about lead up to this. You've got to have a point person, right? You need to have that cybersecurity champion. You need to have your SMEs readily available. Probably your technical people are going to be really busy, so you're probably not going to have access to them. So you need to know what to do and feel comfortable acting at a moment's notice. Again, you need to know your data and your systems. You have to have those controls in place. People need to know how they're supposed to behave. Your technology should be locked down to the best that it can be. You should have encryption in place. You should be using multi-factor authentication. The firewalls should be set. All the things that we were talking about. And these should be ingrained in you. We don't want you to lose time. Because what has to happen is there needs to be an action plan. And everybody should understand what the action plan is. And this should be well in advance. My friend Teresa Lanowitz from the Level Blue had quoted that only 38% of the healthcare entities she had interviewed had an action plan ready. So that is a number one key takeaway. And if all you can control is what you do for your job, start there. Remember, you want to react quickly. You need to identify what your contingencies are so you can be business as usual as fast as possible. You need to be communicating, perhaps to third parties, perhaps to the authorities, perhaps to the news media. All these things should be built into your plan so that you are able to understand what happened, isolate the technical components that were negatively infected, get rid of or eradicate what happened, and restore. One more quick best practices for those who may be technical. I'm starting to see entities have a third-party backup location ready that is actually loaded with their data as of whatever the date is, and they get a third party to attest to it, and then they take it offline and just have it ready. And they repeat this every 30 days or 90 days. So they have an area that they could immediately restore to as soon as they can figure out the breadth and depth of the whatever went wrong. I've mentioned all along there are a number of great references and places you can go. I mentioned the 405D. This is the link to that. CISA, you saw the Iranian slide about and probably the F5, I think, was a CISA bulletin. NIST has a cybersecurity framework, which is a wonderful next place to go to. If you feel like the top 10 are in place, but you want to do more, great reference tool for you. And I've also quoted some other cybersecurity performance goals, next kind of level to take this a little bit deeper if you would like. Next slide, please. I've mentioned a couple of times the Administration for Strategic Preparedness and Response, my friend Charlie Hess. I really like this reference material, especially if you're in healthcare data exchange and you've got clinical operations. This thing had all kinds of wonderful toolkits and suggestions, and it had checklists and things like you have to have pencils and pens, you have to have paper, you have to have, all the things that we used to use before everything was electronic. So I highly recommend taking a look at this one as well. Go ahead to the next slide, please. You can go to the next. So on demonstrating trust, I've mentioned this a couple times. And this is both about, it doesn't matter to me whose program you use, but the ability to take the standards in our industry, HIPAA, high-tech, NIST cybersecurity framework, NIST 800-171, maybe NIST 853, all of those standards, and be able to take your organization and voluntarily say, I will go through a process and prove to you I'm clean, I can do all the things I'm supposed to do, and then have an independent third party that has a strong governance that constantly keeps up to date with these changes for you, go through and basically do an audit and be able to provide you with reports so that you can prove to others you can be trusted. That is exactly what happens in the high trust space with high trust certification, and that happens in the accreditation space. So I will be leaving behind my contact information if you're interested at all in your organization, maybe looking at accreditation, or if you just want to know that when you look at your third parties, you can trust accreditation, please do outreach to me after this. But the importance of being able to trust each other is paramount in today's world. Go to the next slide, please, Josh. Okay, I'm coming up on 11:43. I think we have some time for questions. I apologize. I probably didn't give you time if there were any questions in the chat. Do you have anything you want to lead with, Josh?
Yeah, we do have a question here in the chat. Can you please talk a little bit more about cybersecurity training and what that should include for a small healthcare organization?
Absolutely. I often get this as an assessor. I'll ask an organization, prove to me where your training is for this time frame. And I'll get maybe one of the free OCR or one of the other, used to be ONC, ASTPR, and I apologize. We have all kinds of acronyms for our federal bodies, but they've got some really good training materials, especially in the area of HIPAA, and you can find them on the websites, and they're wonderful. And I'll say, that's great. That is general awareness. Now I want to know, I'll say to the entity that I might be reviewing, specifically, what kind of training are you giving to your workforce members as it relates to the way you want them to behave? So I would expect your workforce members to be trained on your policies and procedures, and that would include privacy, security, cybersecurity, incident reporting, how to handle email, you name it. Possibly having signed acceptable use agreements, and possibly having tests as part of training, and then probably also having phishing campaigns where you're tested to see if you'll open a bad link in an email kind of thing. And I think what's most important is that training is ongoing and you pepper the people on an ongoing basis. You must do what you have to do for HIPAA security and privacy, where you have to train on your policies, procedures, and help them have an understanding of what they're supposed to do. But to the degree they can really understand how they're supposed to behave, that's the best way to make sure that you spread the cybersecurity readiness across your organization.
I do have another question. For those who are listening or will listen after the fact, if they were to make one technical change out of everything you've discussed today, what would you recommend that they do or focus on?
Thank you. I'm actually going to steal an answer here again from my friend Charlie Hess at the Administration for Strategic Preparedness and Response. She was asked this question, and I thought, and I was thinking of the ones that I had, but thinking only about technology, I think one of the most important changes we could see today is using multi-factor authentication. I think we have to see that. And that's assuming that you've already nailed encryption and making sure that all your endpoints are encrypted at rest and that you use encryption in transit. So if those are the questions, Josh, I'd just like to repeat, remember that cybersecurity readiness is patient safety and it's everyone's business. And also, please do feel free to take this leave behind document, the one that has the Weedy name on it, that has the top 10 tips, and socialize it across your organization. Feel free to share it. It's meant to be used across the industry. And we greatly appreciate your attention today. And I hope that if you just do one thing moving forward, that will help in all of us be more prepared for a cybersecurity attack.